This podcast is brought to you by Meteorate.
Welcome, people from all over the globe, to our very special, seriously funny Wellbeing podcast number 14. This episode subject is on medical checkups and screenings. And with me, as always, is one of the world's most foremost preventative health experts, Dr. Ross Walker. Ross, great to be with you. You are busy.
Always busy, mate. Always healing the damn sick. They're always there to be healed.
So any mediocre humour to kick off this session in the light that you aren't as funny as me?
Yeah, look, I was thinking of starting a new business, Homer.
Yeah.
Where I want to actually develop a company that makes coffins and condoms. And the slogan's going to be, "We've got you covered whether you're coming or going."
Good one. I like that one. Okay, so let's kick off this session with an explanation to our listeners on some medical terms. Ross, you are like and many the listeners have made this observation, you are like the quintessential human medical encyclopedia, and you have the potential to comprehensively bamboozle people with some of the medical terms you use. And notwithstanding, I speak 3 or 4 languages, I too get bamboozled occasionally. So in my relentless pursuit to make you understood to our listeners, here are some popular basic medical terms and what they mean next to them. So here goes. Artery, the study of fine paintings.
Yes.
Bacteria, back door to cafeteria. Barium, what doctors do when patients die. CAT scan, searching for kitty. Cauterize, made eye contact with her. Coma, a punctuation mark. D&C, where Washington is. Enema, not a friend. ER, the thing on your head that you hear with. Fester, quicker than someone else. Jeans, blue denim slacks. GI series, World Series of Military Baseball. Hemorrhoid, a male from outer space. Impotent, distinguished, well-known, medical staff, a doctor's cane. Morbid, a higher offer than I bid.
Oh, gee.
Nitrates, cheaper than day rates.
Oh, yeah.
Organ transplant, what you do to your piano when you move.
Right.
Outpatient, a person who has fainted. Pap smear, making fun of dad.
Oh,
Pathological, a reasonable way to go. Pharmacist, person who makes a living dealing in agriculture. We're almost there. Pelvis,
thank God.
second cousin to Elvis. Post-operative, a letter carrier. Recovery room, place to do upholstery. Rectum, almost killed him. Red blood count, Dracula. Secretion, hiding something. Seizure, Roman emperor. Terminal illness, getting sick at the airport. Thorax, a Dr. Seuss character. Triple bypass, better than a quarterback sneak. Tumor, more than one, an extra pair. Varicose, nearby, blah, 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 blah. Yeah, they were ecstatic, and by your reaction, I can see you were over the moon.
Oh, yeah, over the moon. I just had to go off and get a strong coffee to wake me up. But anyhow, that's all right. That's fine. Keep going. I digress.
So we've got this one as a lead into this session. A surgeon, an internist, a psychiatrist, and a pathologist go duck hunting. You know what ducks are?
Yeah, I do.
I do a great duck impression. So I do a very good duck impression. And I've entertained my grandkids and many infants, even corporate audiences, with my duck impersonation, especially with the sneeze when you go, "Ew, ew." They find that funny for some reason. So 2 ducks fly by, and the internist takes aim, then puts a gun down and says, "I think we need some further investigations. I'm not sure those were actually ducks." A few moments later, another swarm of ducks fly over their head. The psychiatrist takes aim, then puts the gun down and says, "Those definitely look like ducks, but how do they feel about themselves? A few moments later, a huge swarm of birds fly by. The surgeon takes aim and starts blindly firing into the swarm. In a storm of blood and feathers, several birds go down. As he puts down his gun, he turns to the pathologist and says, "Can you go and look whether I got some ducks?"
Yeah, that's
It's a pretty ordinary punchline, isn't it?
very extremely.
That's what they call a joke that should bomb out normally.
Yeah.
Because there's all that preamble, and then the punchline is quite mediocre.
Yeah, and even the preamble was pretty mediocre, I've got to say. But anyhow, there we go.
Let's get on to medical news, Ross.
Let's do that.
Yep. Multiple surgeries and cognitive decline.
Yep. Yeah, this is a really interesting study that was done. Where was it done? I'm just trying to figure out exactly when this was done.
Just make up.
I've had too many surgeries. No, I'm just getting to the
come out
page
of
where it
Athens
was done.
or Italy or Zagreb.
No. It was actually an Australian study, and basically University of Sydney, but from data from a thing called the UK Biobank. Now, the UK Biobank is this wealth of data from about 500,000 people, where they've looked at all aspects of their lifestyle, what they eat, what their blood's doing, is all these genetic markers, etc. And they took people between the ages of 40 to 70 with a follow-up for 20 years, did brain scans on them, do cognitive testing, and they found that the more surgeries people have over the age of 65, the worse they score on cognitive testing, and the more brain scans demonstrate loss of brain volume, brain function. So the message here is pretty simple. This is from just under 47,000 people, by the way, so very extensive studies. The message is, and I say this all the time to my patients, over the age of 65, make sure the anaesthetic is absolutely vital.
Yes.
So reserve your general anaesthesia for things that are really important. So I'll give you one great example. In my own field in cardiology, there's a very common condition called atrial fibrillation, where the heart beats all over the shop. And we have a technique called atrial fibrillation ablation, where you go in through the vein in the groin up into the heart. It's a very intricate procedure, but it's a 3-hour general anaesthetic. Now, I think it's a legitimate thing to do for a young'un, someone under the age of 65, but when you get over the age of 65, a 3-hour general anaesthetic that isn't vitally necessary when you do have the alternative of being on chronic pharmaceutical therapy, that's the one I'd go for in that situation. So there are times, for example, knee replacements, hip replacements, bypass surgery, neurosurgery, gastrointestinal surgeries for major cancers or whatever. Those things are vital if people are in agony from their knee pain or whatever. But don't go and have cosmetic procedures over the age of 65, and don't go and have procedures where there are medical alternatives. So that's the message.
There's a connection between cognitive decline and frequency of anesthesia.
Frequency and length of anesthesia.
Okay.
And
what about the equation? If you're fitter, do you tolerate that more?
Look, I'm sure that's the same with every condition. If you're fitter, if you're fitter and you're not carrying a lot of weight, you tolerate many things better.
Yeah.
So yes, there is a correlation there, but it's not always true. What it's saying is across the board, the more anesthesia you have, the more risk. It's not a definite thing, but the more risk there is for cognitive decline. So all I'm saying is always ask the right questions, always seek a second opinion if you've got a condition that may require surgery, especially if that surgery is long.
Okay. Future of medicine, low-cost portable device to detect cancers. That's a real important one, isn't it?
Yeah, this is an interesting one, you see, because for years, a lot of the ways of detecting cancers have been with biopsies. Now, biopsies are quite invasive. For example, for us wimpy men who've had to go through childbirth or any of those dreadful things, when you get to the 60-plus age group, then the prostate cancer looms its ugly head, and about 1 in 9 men will develop prostate cancer throughout their life, probably over the age of 80, if you ripped out the prostates of men over the age of 80 and had a careful look through them, and I wouldn't suggest you do because it creates a shocking mess on the floor, but if you did, you'd probably see traces of prostate cancer in most men over the age of 80, which should be ignored because they'll die with it rather than from it. But equally then, if people have indications of cancers, often they have to be confirmed with a biopsy. So we're getting to the point now in medicine where we're being able to diagnose these things so much earlier and so much quicker. So this new device basically is a low-cost portable device, just a pinprick. You put a little bit of blood on a blotting paper into this device, and it can pick up things like prostate cancer, colorectal cancers, because how it works, Homer, this is really interesting.
Mm-hmm.
When you develop a cancer, even very early on, that cancer releases what we call circulating tumor markers. So everyone's cancer has its own DNA footprint. And this DNA footprint releases little bits of this stuff into the bloodstream, which is now getting to the point where we can pick it up very, very early. So exciting stuff, not clinically available right now, but it's not too far off.
Interesting, isn't it? Body of evidence, pancreatic cancers, why are they so difficult to treat and diagnose? And just off the cuff, pancreatic cancers appear to be one of the most sinisters of cancers in terms of...
I'll tell you a dreadful personal story. Well over 15 years ago, I hadn't seen my mother for about 9 months because she lived up in Queensland and just hadn't been able to travel. So she came down to visit and she looked like a skeleton, and I knew straight away she had pancreatic cancer. She'd had no diagnosis made when she was living up there. And so I did some tests and noting what I was going to find, and found a huge pancreatic cancer. I had to make the diagnosis and tell her, which was pretty upsetting, and she died about 3 months later.
Wow. And why wasn't it diagnosed?
I don't want to go into that.
Because of the rural... Okay.
I don't want to go into that. But anyhow, that aside, it was a really horrible thing. So pancreatic cancer is extremely personal to me.
Yeah.
Now, I want to explain to people why, A, it's so hard to diagnose, and B, why it's so hard to treat. One of the reasons it's so hard to diagnose, it's really a hidden organ. It sits the back of the stomach away from everything, and any symptoms from pancreatic cancer, a bit like ovarian cancer, presents very late. So people don't start to lose weight or don't start to lose their appetite or be nauseated until the pancreatic cancer is pretty advanced. That's the first problem. And also with that, we don't have great screening tests for pancreatic cancer. But also with pancreatic cancers specifically, they have a very strong what we call fibrous shield. So the fibrous tissue is really the very strong connective tissue. And these pancreatic cancers have this fibrous shield around all the cells, which make them almost invisible to the immune system. So now that we understand all of these things, what's happening is we're moving closer to getting better treatments that'll break down that fibrous shield, better tests that'll be able to pick up the disease so much earlier, and also using other therapies together. So, for example, a study was done on mice who were genetically primed to develop pancreatic cancer, and they found that if they put those mice on a ketogenic diet, or in other words, switched off glucose as being the major fuel for the pancreatic cancer, and then used a substance that blocked the ability for the pancreatic cancers to use the fat from the ketogenic diet, then they starved the pancreatic cancer and the mice actually arrested their cancers. So what we're talking about here is a comprehensive program that firstly break down the shield so the immune system can see the pancreatic cancer, use maybe some dietary manipulations with some other drugs that go with that to starve the pancreatic cancer of its fuel, and use some other things. So some interesting work with a version of folic acid called folinic acid and some B6. And I'm not saying if anyone has just been diagnosed with pancreatic cancer, I'm not telling them to start taking folinic acid and B6. I'm just saying all of these things are being used as advances in pancreatic cancer.
So as I reach for a sip of my cup of coffee, the link between coffee and caffeine and pancreatic cancer.
There
Is
is
there a
no
strong
link.
one?
In fact,
Okay.
if you have a couple of cups of coffee a day, you reduce your risk for most common cancers. Now, pancreatic cancer is not a particularly common cancer. It's nothing like the common ones like breast, prostate, lung, colorectal cancer, melanoma, and the other skin cancers. But it's still getting there. It's still not rare. But if you enjoy a couple of cups of coffee a day, you reduce your risk for many diseases, of which the common cancers are one of those diseases.
Because of the polyphenol content within.
Yeah, the
coffee.
polyphenol concept,
Yep.
but also there is some benefits from caffeine as well. So, for
Yep.
example, a couple of cups of coffee a day with the caffeine,
Yeah.
there's a lesser Parkinson's disease and Alzheimer's disease as
Yeah.
another gallstones, kidney stones.
Controversies and vitamin D. I've been listening up a fair bit on this. Vitamin D, the sunshine vitamin, being of Southern European extraction. How normally I need more vitamin D because I've got the dark color of my skin. But they also have other elements. It's called the sunlight vitamin. But there's other elements to sunlight that apparently are very good for you. One of them is that it helps the body secrete melatonin.
Yeah.
So go ahead. Useful or not?
Well, this is just focusing on it because you see, again, if you listen to conservative medicine,
Yep.
they'll tell you that vitamins are useless.
Yeah.
You're basically just creating expensive urine.
Yeah.
Now, I agree with them. What you don't need, you excrete out. But you also get expensive or valuable blood by taking vitamins as well.
Yeah.
And there's a couple of interesting studies that have just been released. One out of McGill University in Canada looked at the fact that we've got this thing which many people haven't heard of before called the thymus gland. So the thymus gland sits in the middle of the chest, and it's really vital that thymus makes your T cells. So the T cells are part of the immune system, and the T cells are really the memory cells that you remember all the toxins you've been exposed to so you can mount a good immune response. But as we get older, that thymus involutes and basically melts away to almost nothing unless you get some sort of weird tumor, a thing called a thymoma. And that can be associated with a very unusual disease called myasthenia gravis that actually Aristotle and Onassis had, just as one exacerbation trivia.
So if I had a thymoma, it'd be a thymoma.
Yeah, thymoma.
Yeah.
Thymoma for the myeloma. Yeah, that's it.
Okay.
So anyhow, this particular study looked at the way that the thymoma works, and that if you are vitamin D deficient when you're younger, it actually increases thymus aging too early. And so therefore it's really important, the theme of that particular study, for children to have adequate vitamin D, which of course you get from the sun. But the problem with Australia, we're of course the skin cancer capital of the world. And if you expose people to too much sun, yes, you give them vitamin D, but you markedly increase their risk for skin cancers. So there's a bit of a balance there. So I like, especially as we get older, but maybe even for children, for vitamin D supplementation. So I believe all of us adults, or all we adults, is proper English, all we adults should be taking 2,000 international units of vitamin D per day. And for example, one study out of the US of 25,000 people over 5 years showed that if you do that, you reduce your risk for autoimmune disease by about 25%. But there's a strong link between low vitamin D, osteoporosis, heart disease, cancer, type 2 diabetes, multiple sclerosis, depression, asthma. There's so many things that are linked to low vitamin D. But the second part of this controversy is a study was just released in the American Journal of Preventive Cardiology out of the US. And this study, called the STURDY trial, looked at people over the age of 70 and gave them different concentrations of vitamin D for a couple of years, and found that it had no influence on markers of significant cardiac damage. So therefore, they're sort of making out that vitamin D doesn't prevent cardiovascular disease. No, this is just ridiculous. They're getting people over the age of 70, starting too late, giving them 2,000. I'm not saying if you're over 70 you shouldn't take vitamin D, but I'm just saying don't expect that 2 years of taking vitamin D will undo 70 years of damage to your arteries.
Yeah.
But it's just a ridiculous study.
So What do dermatologists feel about exposure to sunlight? Should it be, for white folks especially, should it be done gradually over time, or
No.
can they have it in
No,
one?
some dermatologists feel we should go nowhere near the sun. We
Yes,
should look
and
like
they're a bit
vampires.
paranoid, aren't they,
Yeah,
about?
yeah, yeah.
Yeah,
Because, this is the problem. It's called the pretest probability.
yeah,
If you see a lot of one thing, then everything becomes that one thing. If everything looks like a nail, so if it has a hammer, everything looks like a
yeah,
nail. And
yeah,
so the dermatologists say to everyone, keep out of the sun. And look, I don't disagree with that to some extent.
yeah.
I think people who sunbake are absolute nuts. But I still think before 10 and maybe after 3 or 4 o'clock, to get a bit of sunlight is probably good for you because you are getting some vitamin D. Or if you go out in the sun at midday, stand there for 5 minutes, but then cover up pretty quickly. So it's the dose that's important.
And if you're
But also
dark,
take the 2,000 units of vitamin D. And some with your skin, Homer, as opposed to some with this skin,
yeah.
your melanin cover is so much stronger than mine, so you don't absorb as much vitamin D as I do. So it's best to swallow the damn thing.
Okay, thanks, Ross. So, Ross, the main topic of this week's podcast is medical checkups,
Yeah.
screenings,
Yeah.
and what should be tested. And I'll give you a bit of a better joke than the last one. A great prelude to this story: when a pirate goes to the doctor and says, "I have moles on my back." Ah, the doctor says, "It's okay. They're benign." And the pirate says, "Count again. I think there'll be 10." Ah.
Right. Oh, yeah. Well, let's hope they do get better.
So,
Yeah, would
Ross,
you
my
no, but
understanding.
just before you do you know what the police officer said to his belly button?
No.
"You're under arrest." Okay.
Okay, so Ross, my understanding is a medical checkup or screening can include a variety of tests and exams. A physical exam, blood pressure. We all know this. We got urine dipstick test, mental health. The doctor may give you a questionnaire to assess your depression, anxiety levels, cholesterol and lipid blood test, mammograms, eye exams, hearing tests, allergy tests, cervical screening. So what's the scoop with medical checkups and screenings?
Well, I say all the time, Homer, the best treatment of heart disease, cancer, Alzheimer's, osteoporosis is not to get them in the first place. It's called prevention. And the best way to prevent anything is to pick up the markers for that disease early and do something about it. And I think screening, good health screening, should start around age 30. Now, why 30? Because most people in their 20s think they're bulletproof.
Yeah.
Nothing's going to happen to me. I can abuse my body, get myself written off on a Saturday night with alcohol and maybe illegal drugs, and I can smoke cigarettes, do whatever. So young men, for example, go to the gym not for good health, but to look good for the opposite sex. And so what I'm saying to you is there's not a real focus on being healthy in your 20s. Some people are. I'm not saying everyone's like this. But what I'm saying is that for most of us, we start to look at our mortality around age 30. So when people reach 30, that's when I think it's about time they started to think about their health because 30 is the peak of your life, by the way, and it's all downhill from there. Sorry to be depressing, but osteoporosis starts at 30. Sarcopenia, which a lot of people don't understand, you would know what that is. That's loss of muscle bulk. That starts at 30. No high-performance athlete is as good in their 30s as they were in their 20s because their hand-eye coordination is not as good and they're starting to get weaker bones and weaker muscles to some extent. I'm not saying it's that gross at 30. I'm not saying it's just boom, you stop at 30, but it just starts to slow down from there. Then you hit 50 and the hormones go south, things wear out even quicker. So what I'm saying is that for people who are health aware and health conscious without being what I call health neurotic, because there is a thing called health anxiety, and this is what does my head in when somebody walks into my practice with the folder under their arm with all their health details in alphabetical order and in chronological order and place marks. And I go,
Tinkering on hypochondria.
well, yeah, we do, yes.
Yeah.
But the point is the study's been done on that. People who do that have a 30% higher rate of heart disease.
Because they worry about it.
Yes, they worry about it. So I say to them, smell the roses, don't analyze the damn things. And that's what people have to understand. There's the fine line between between being health aware and health conscious and being health neurotic.
But should we be pushing for functional health, for functional fitness?
What do you mean by that?
Being fit enough to do what you need to do in a day and doing it well, instead of, like what you're saying with the 20-year-olds, that they want to look better, they need to function better.
Oh no, of course, but that's a process as you develop more maturity around your life. And so I think 30 is a good starting point. So what should you do at 30? And so here's the question. So I've written some notes on this, so I'll go through it, and I'll try not to make it too boring, but certainly have a clinical assessment, which you've already mentioned. Have your height, your weight, your BMI done, but also your waist circumference. I think waist circumference is much more important than looking at BMI, because there's a thing called relative fat mass, which is much more accurate as an indication of your total body fat, because no one wants to lose weight. They just want to lose fat. So relative fat mass is the simple equation: 64 minus, in brackets, 20 times your height divided by your waist circumference. Okay, that's for a male. For a female, add 12, because women want a relative fat mass less than 35%, men less than 25%.
Yeah.
So that's the way to do it. So basically have all those things done. Have your pulse checked. Have your blood pressure checked. Every time you go into a doctor, especially over the age of 30, but even before that, it takes 30 seconds to check your blood pressure. It's the most important, simple, cheap cardiovascular screening test. And probably at age 30, if you've never had one before, have an ECG. Just to make sure you have a normal pattern ECG once. You don't need to keep doing these things. This is a one-off initial assessment. Then when you have your blood, then start and have your first lot of blood tests maybe at age 30. Some people have had them before that, but I'm just saying if you've never had them before, what should you have? Well, things like a full blood count, looking at red cells, white cells, assessment of kidney function, liver function. I think it's not bad to have a thyroid check as well. There's a thing called ferritin, which is iron stores.
Yep.
So the ferritin levels, the iron stores, are a very good marker for a lot of different things, very simple tests. A fasting blood sugar level and hemoglobin A1C. Now, let me explain to you what that is. Hemoglobin A1C is average 3-month sugar control. Now, let me also say there is a test called a glucose tolerance test, which many Australian GPs order, and it's 2 hours of your life you'll never get back. It's a complete waste of time that should not be done, but is done too often. And when you ask the GP, why do you do this? Oh, I'm checking for diabetes. You can check for diabetes by a fasting blood sugar level and hemoglobin A1C. You don't have to put someone in a pathology department, get to swallow this horrible sweet tasting stuff and wait for 2 hours having blood tests. Waste the time, so don't do that. But also, at that first blood test, you need to have checked once in your life a thing called lipoprotein little a. So that's lipoprotein, lowercase a in brackets. That's the cause of 1 in 5 cases of heart disease. With that, there's a test called HSCRP, which is an indication of how inflamed things are in your system. And you want that test to be less than 1.5. And also, I'm a great believer in a thing called homocysteine. So we had a podcast, I think it was podcast 7 from memory, on the MTHFR gene, which I think everyone should have checked at age 30. Now, why? Because 50% of people have an abnormality in that. And so that needs to be managed. A B12 and a folic acid level, and also a urine dipstick. So you basically pass some urine, GP puts a check in it just to make sure there's no protein or blood or other stuff in your urine. And that's basically all you need at age 30. And many of those tests, apart from the lipoprotein little a, need to be rechecked about age 40. And then at age 50, you start to need to get a bit more serious about things, because that's when the diseases are really starting to rear their ugly head. So I introduced into Australia 25 years ago a thing called coronary calcium scoring.
I know it well.
So, as you do. But all males at 50, all females at 60 should have, as a routine, a coronary calcium score. Now, there's a but there, Homer. If you've already had heart disease, it's a waste of time and money, because it's there to diagnose your risk for heart disease.
So if you've already had a stent put in...
Yeah, already had a stent, it's a waste of time.
Yeah.
It's not retrospective.
Okay.
You know there's a problem, it needs to be treated.
Yeah.
But what the coronary calcium score tells you is how much muck you have in your arteries. and therefore how much you need intensive treatment of that muck. So, for example, many people go into the doctor with a high cholesterol level and immediately the doctor throws a statin at them. They can have a 0 calcium score. They don't need the statin. If your calcium score is below 100 between the ages of 50 up to about 65, 70, you don't need a statin. I don't care if your cholesterol is 10. If you've got a 0 calcium score, statins are unnecessary. Even if your calcium score is 50 at age, say, 60, that's nothing. Forget about it.
Yeah.
But everybody needs to practice the 5 keys that we spoke about in one of the earlier podcasts. But not everyone needs to be on drugs, and that's what the calcium score tells you. But the calcium score also tells you your prognosis over the next many years. And I do a calcium score if it's in the low range every 5 years. If it's in the high range, I don't do it again because it's just like you've had a stent. You know you need treatment. So don't keep repeating calcium scores. And with LP-A, the low protein, you only need it once because it's either high or it's low. It doesn't change much over life. So I've got people who misinterpret this and they track their LP-A. And it does that and they're worried if it does that or does that. It's rubbish. It's either high or it's low. Okay. So that's so the coronary calcium score, but there's another but. If your father had a bypass at 50 and you're a 40-year-old male, have the calcium score at 40. If you're a 40-year-old female and your father had the bypass at 50, have your calcium score at 50, because the difference between men and women and heart disease is about 10 years. Women are protected by their hormones until menopause. Okay, so what else should we do? At age 50, I think men should have a PSA test, which is the prostate cancer screening test, and have that every couple of years. But you've got to cheat for your PSA because the PSA is very much related to sexual activity. So
can I just say not on the sexual activity, but on the PSA screening?
PSA, not PSA.
I had a friend of mine who was a professor in urology.
Yeah.
And he was adamant about men not having their prostate checked at all because he said the vast majority of them die with live the breast cancer. You wouldn't agree with that, would you?
No, I don't agree with that because look, a big study in the New England Journal of Medicine, 1,500 men diagnosed with prostate cancer. A third were in the prostatectomy group, a third were in the radiotherapy group, and a third were just what we call expectant watching. They did nothing. After 15 years, 97% were still alive. So whether they had treatment or no treatment, they were still alive. But there was 3 times the rate of spread in the people who did nothing. So I think active surveillance is important for many people.
Yeah.
But again, I don't think we should overinterpret PSA tests. I don't think we should have them too often. But if I see a trending up in PSA, I want to make sure that person doesn't have markers for more aggressive disease. Now, the professor of urology knows a hell of a lot more about urology than I do. That's his opinion. But you can speak to other people in urology who believe that PSA screening is important. And we mentioned before about the point of care tests, the simple tests for early cancers. We're getting better at diagnosing prostate cancer early. And it doesn't mean you need to go in and rip the thing out, but we're also getting better at managing these things as well. So everyone's going to have different opinions. I've seen world leaders in any area arguing tooth and nail that they were right, and the other guy, who was also a world leader, his opinion was wrong. So it's all opinions.
Do you think we'll ever get to the point where we maybe the Microsofts of our world, the techno gurus out there, come up with the bee's knees for medical screening, where they can tell within half an hour, maybe a scan, of whatever ailment you've got.
Oh, look, I think there'll be a blood test where you can just map all the different proteins and whatever and the different genetic makeup, so they will say, yes, you're at risk, you're not.
Are we close to that?
We're not far. No, I'd say probably to that accuracy, maybe 10 years. So we're not that far. We're not talking about 30, 40 years away. So that you remember the Star Trek where Bones, the doctor, you should just put this machine on and go, this is the problem. We're getting close to that. We're getting close to that. So what else should happen? For women, mammography should start at 50. Now, why? There are three advantages of being over 50, Homer. Number 1 is wisdom. Number 2 is grandchildren if you've got them. And number 3, you lose the cancer risk from medical radiation. So
Okay.
the less radiation you have up to age 50, the less risk of cancers 15, 20 years down the track. So what I'm saying is that if you start mammography at age 50 as a female, it will detect more cancers than it will induce. But if you start at age 40, it'll induce more cancers than it will detect. So you've got to get the right. So you're not going to get a breast cancer out of having mammography starting at age 50.
And
So
that always is a concern for people that are being diagnosed for cancers and everything, is the radiation exposure.
Yeah, but
from the
don't
whole-
worry about if you're over 50. I'm not suggesting you should phone up for a CT scan every day. I'm just saying to have a CT scan every 5 years is not going to cause a cancer in 20 years' time.
So the rationale being it will take 15, 20 years.
No. The rationale is our cells change and become less sensitive to radiation when you
okay.
hit 50
There
because
you go.
there are so many changes in the body. So, but I have seen people who, for example, there's a thing called CT coronary angiography, where you squirt someone full of dye and they have a CT that takes a picture of their arteries. Beautiful pictures of their arteries. But I see some people ordering this in 35-year-olds, and then 20 years down the track, they've got a cancer.
Yeah.
Possibly from the radiation. So the first line of the Hippocratic Oath, first do no harm.
Yeah.
Now let me also say there's a thing that the National Bowel Cancer Screening Test is a vitally important test that from the age of 50 we should all be doing. And I believe that everyone deserves one colonoscopy in their life over the age of 50. Some people I know should have one a week without the anaesthetic. But what I'm saying is colonoscopies are important to have one. I'm headed for my 5th one pretty soon because my father died of bowel cancer. So if you've got a bowel cancer history in the family or one of the genetic conditions such as Lynch syndrome, you need to have more regular colonoscopies. But for all of us, at least one. And then finally, the DEXA scans, which are the scans for osteoporosis. Over the age of 70, they're free for everybody, but below the age of 70, if you've got risk factors, so you've had fractures or you've been on steroids or whatever, it's important to have a DEXA scan a bit earlier because here's the statistics: 25% of women, postmenopausal women, will have osteoporosis. 5% of men over the age of 65 will have osteoporosis. But a study came out the other day saying that 65% of people over the age of 50 have some degree of osteopenia, which is the grey area before normal to osteoporosis. So 65% is a big number.
And that might have, from an exercise perspective, a lot to do with non-weight-bearing exercises, how people, when they get to a certain age, they don't walk and run as much and do weights as much.
Look, can I say to you, mate, all disease is genetic. I've said this before. Osteoporosis is genetic.
Mm-hmm.
Regardless of that, the best non-pharmaceutical treatment of osteoporosis is exercise, which should be 2/3 cardio, 1/3 resistance training. And so it's so important still to exercise, whether you do or don't have osteoporosis, because the benefits of exercise are just overwhelming. But 50% reduction in osteoporosis for people who exercise 3 to 5 hours a week. So when should screening stop? See, that's another interesting question, because I think every 10 years you should have a set of preventative screens the way I've just said.
But before
every
you
5
get onto
years.
that, when should screening actually start? So let's get back to colonoscopies.
Colonoscopy after age 51.
Okay, no, but so I had my first colonoscopy 10 years ago, and they detected a polyp. And
well, if you've had a polyp, you should have had one 5 years later, depending on the size of the polyp or the type of the polyp. There are different types of polyps.
It was a small polyp.
I'd have another one. But if just say you were 55 years old, you had a colonoscopy, no polyps, everything was fine, don't have another one. But if you've got the family history or you've had polyps, you need to have those followed up because they
every
can
5
regrow.
years.
Every 5, or depending on the histology, when you look at the polyp, what it looks like. There are different types of polyps. Okay. So when should screening? So screening should be every 10 years up to about age 75. Now, I'm not being ageist. I'm just saying if you've made it to 75 without a problem, you're probably not going to get it. So you're wasting your time, money and energy going for the screening for it. So this is something that most of my colleagues don't agree with, which is unusual for me to say stuff that people don't agree with. But that aside, I think screening cholesterol in people over the age of 75 is medical negligence if they haven't had heart disease. If you've had no vascular disease and your calcium score is low, don't have a cholesterol checked over the age of 75. The worst call I ever had to my radio show, and we give shameless plugs on my radio show for this podcast. I'll give a shameless plug on this podcast for my radio show.
Yeah.
It's on the Nine Radio Network, 6 to 9 every Sunday night. It's called Healthy Living. It's a
Great
fantastic show.
Great
Thank you, Homer.
Yep,
Yeah,
yep.
But anyhow, the worst call I ever had was this woman rang up and said my 95-year-old father's general practitioner wanted to start him on a statin because his cholesterol was 5.2. Now, you're not allowed to use, or you're not allowed to swear on radio, but I certainly wanted to when I heard that. I think being idiot would have been the right thing to do. Why would anyone measure a cholesterol in his 95-year-old? I mean, why would you even think of doing it? And then why would you discuss statin therapy in a 95-year-old? It's just nonsense. It is medical nonsense to do that. So stop screening about 75. But when you talk about the categories of screening, there's the general things we've spoken about. There's the cardiovascular screening, which is going to move to what we call metabolic screening. So that's looking at lipids, glucose, liver, kidneys, and a thing called the omega-3 index is a good thing, where you prick the fingers and it tells you what your omega-3 index is, and that's something we should talk about another time. Then we can screen for all the common cancers that I mentioned. So if you're a smoker, does anyone still smoke? Or a vapor, just as bad? You can screen for lung cancer with a screening CT, colorectal cancer we've discussed, breast we discussed, gynecologic screening for other gynecologic conditions for women, prostate, and of course, everyone needs to have skin checks every couple of years, checks for bone health we've mentioned. You need your eyes checked every 2 years, your hearing checked, and everyone should have very regular dental checkups because the mouth isn't just localized to that. It can have an effect on the rest of the body. And you also alluded to mental health checks as well, cognitive screening tests for people that are starting to have some problems with their memory. And we're moving into the genetic era where we can do genomic testing, epigenomic testing, so it's the environment's interaction with the genes, proteomics, looking at all the different protein markers in the bloodstream, metabolomics, and I've already sort of alluded to that, how are your organs functioning? And then the microbiome, which is another thing. I still don't think we're right there with microbiome screening yet, but they're talking about, this is more a future of the medicine segment, but they're talking about now developing smart toilets. So every time you open the bowels, the toilet will analyze your gut bacteria and give you a rating on that. So
wow.
So some exciting things happening.
Okay.
Yeah, no shit.
Yeah.
And then there's finally, we're getting to the point of being able to assess people's immune function, not just by looking at HSCRP, but by looking at the subtypes of different immune cells. There's things called CD4 cells, CD8 cells. A lot of exciting stuff happening in the world of screening. And as I said right at the start, and I'll say it again, best treatment of all these diseases is not to get them in the first place. It's called prevention.
Yeah. And you know what I was thinking? Remember, we were talking about the blue zones a while back, and you mentioned that Greek or Italian gentleman who was diagnosed with cancer.
Stomatus moriatus.
Yeah, stomatus sounds like one of my characters.
Yeah.
Stomatus moriatus.
Yeah.
And remember, he was diagnosed with a fairly aggressive cancer.
He was.
And
lung cancer. He was a smoker.
And he went and joined the blue zones.
Yep.
And cured it.
Yep. Well, basically, age 60, I'll tell the story because it's a really interesting one. 1972, he was 65 years old, and he was a smoker, heavy smoker, was diagnosed in New York as having lung cancer. He had 9 months to live. So got 2 more opinions. They all said, 9 months to live. So he said to his married daughters, you stay here with your husbands, but your mother and I are going back to live with my parents in Ikaria. So he goes back to Ikaria in Greece, lives on this beautiful island, in isolated island, 50 k's off the coast of Turkey. And he's pretty sick, this guy. He's coughing blood, he's short of breath. But he starts living the Icarian lifestyle, eating the natural foods out of his parents' backyard. He starts having a glass of wine with his friends who are coming to say goodbye to him. Childhood friends would call over, he starts having an afternoon sleep. Study of 23,000 Greeks. Those who had an afternoon sleep had a 40% reduction in cardiovascular disease. The working Greeks, not many of those left. 50% reduction in cardiovascular disease. And then he starts reconnecting with his faith, walking gingerly around the village. After 3 months, goes to the doctors and they examine him and they go, stomata's not too bad. You're okay. Come back in 3 months. Comes back in 3 months, no trace of cancer. So 25 years later, Stomatis decides to go back to New York to visit his daughters. And she goes, and he gets there, he says, while I'm here, I'll go and see the doctors and show them how healthy I am. He couldn't because they were all dead. They were all dead. So Stomatis lived to 104.
So the philosophy is there that the body always heals itself if it's given the right conditions.
Yeah.
And it's up to maybe...
No, the body has the best chance of healing itself if it's given the right conditions. You can't say it always heals itself.
Can you understand the cynicism with a lot of listeners out there? So we need to get tested for everything. It's almost like the paralysis of analysis. Do we have to be tested for everything? Let's just say we take a back step and eat well, exercise well, do the whole lot, and not get too concerned, especially with some of the psychiatric.
Yeah, but look, I hear what you're saying, mate. Yep. But the reality is,
you need to
less than 10% of people do exactly what you're suggesting.
Yeah.
Less than 10% of people come even close to living in the blue zones. So you've got 90% of people who are abusing their body in some way, and they're the ones that are getting these diseases. So I'm not saying those people in the less than 10% will never get the diseases. I'm saying they just don't get them as often, and when they do get them, they get better quicker. So
that's a huge statistic you just mentioned there, isn't it? 90% of people listening to this are sedentary.
And eating bad food, they're unhappy,
the right thing,
they're unhappy, they don't sleep well, they're smoking or drinking too much. And can I say to you, and this is a dreadful statistic, only 5% of the population have 2 or 3 pieces of fruit per day, 3 to 5 servings of vegetables per day, and those who do have the lowest rates of heart disease and cancer and Alzheimer's in the community. And it doesn't do zip to your cholesterol, it just keeps your immune system healthy. So that's
how current is that statistic?
That's very, very current.
It's amazing.
5%. 5%. It's appalling.
So
one of the most important health innovations you can do, fruits and vegetables, only 5% of people do it.
So you'd have to say that health promotion programs in this country have failed.
No, I think they failed only because people don't listen to them. Look, I can tell you, mate, well,
that's why you have a health promotion program.
In my own practice, I line up 100 people, give them a program for good health. After 12 months, 50% have stopped. And I can tell you, there's a line in the sand in my practice. There's people who listen to what I say and people who don't listen to what I say or don't follow what I say. The ones who listen to what I say and follow it just become long-term mates of mine. Nothing ever happens to them. The ones who can't or won't follow the advice whittle away bits of their heart to their premature death. It's a decision you make every day. When you're standing there, there's a set of stairs, there's a set of escalators. When you go up the escalators, not the stairs. When you get there at the breakfast table and have some processed packaged crap masquerading as food, as opposed to having healthy fruits, vegetables, nuts, grains, etc. for your breakfast. It's just a decision people can make every day of their life. And I say all the time, life isn't about making the big decision to be healthy. It's about making 30, 40, 50 small decisions every day of your life that takes you to good health or bad health. It's your decision, which I think is a very good way to end this podcast.
Beautiful. I was going to ask you a question. If we have 50% increase in people doing the right things, would we then only need a 50% less medical screening right across the board?
Possibly, yeah. And yeah, look, if everyone followed the 5 keys of being healthy, I'd be twiddling my thumbs all day.
Okay.
But they don't. And the point is, again, even if people do have a problem and you pick up that problem relatively early, you can reverse a lot of the effects of the problems, especially if they will then change their life.
Okay. We've got questions from our listeners that have been emailed in. This one is from Karen. I think she's from Melbourne. Karen. And Karen asks, "Hey, Homer and Dr. Ross, love your podcast. Homer is significantly funnier than you, Ross.
No, she didn't say that. She did not say that. She didn't
Primarily,
say it. You're just lying now.
no, but she says, I do love the Seriously Funny podcast. It's the funniest podcast I've ever listened to, primarily because it's the only...
Is she serious?
Yeah, it's the only seriously funny podcast that I've listened to. That's why she thinks it's so funny. But seriously, I've just discovered the podcast. Love it. I'd like to ask about the supplements that you referred to but cannot publicly name.
Yeah. Well, I still can't because it's a public podcast.
Okay, so that means I can't.
Okay, look, can I tell you, I basically think that everybody from age 30, well, this should be another segment. This is too long. So let's make no, look, Karen, we'll, a quick snapshot, high quality multivitamin, high quality omega-3 supplement. When you hit 50, everyone should be on the BJ 100, and I can't mention the name of it. You should be taking some form of vitamin K2, ubiquinol, magnesium orotate, and kyolic garlic, and vitamin D. And they're the basic things. But I think we should have a podcast just devoted to supplements where I will not mention products, but I can mention ingredients.
Yeah, I think we have. We're talking about the adverse effect of supplement in the next podcast, aren't we? As well as medications in the next one. Yeah. So Karen's still going on. My husband is 65. He's being prescribed blood pressure tablets and statins, although he will be requesting a calcium score as he was prescribed them purely on his cholesterol levels.
Yep.
Anyway, besides that, can you please recommend a good ubiquinol brand and a good magnesium brand?
I can't, because this is a public podcast, I cannot give the brand name. Just let me say that if you buy it in Australia, you are getting a high quality product. Do not buy it on the internet from America. So it's ubiquinol, 150 milligrams a day. That is the dose. And a magnesium orotate aspartate combination. Again, just Google magnesium orotate aspartate combinations, usually around somewhere between 400 to 800 milligrams of magnesium in the compound, taken twice a day.
Okay. Is there anything else that we should be taking as a preventative measure? This is Karen still.
Well, again, this gets back to talking about the cardiac protocol, and which I think we should focus and go through. In another podcast, we should have it just devoted to why should people take supplements and what should they take.
Yeah. So this is from Gloria on the Gold Coast, and she asks, I had grief-induced tinnitus. It came
on a real ring to it.
Yeah. It came on the day after a hectic week of watching my mother slowly pass away. Sorry for making fun of it.
So sorry to hear that, Gloria.
Expected it would lessen in time, but it has now been 14 months and I still have a ringing, buzzing in my ears. It isn't loud during other noisy situations, but as soon as noise disappears, it's still there. I've been to a doctor who referred me to an audiologist who confirmed there was no physical damage with my ears on or any issue with my hearing. I have attempted different ear piercings based on pressure points to try and ease it, as well as taking certain vitamins which are said to lessen the symptoms, but still no luck. Any hot tips?
Yeah. Look, tinnitus is a shocking problem for many people, and when she's been told there's nothing wrong with her ears, well, it clearly is because she's got tinnitus.
Yeah.
So there's what I call the poor man's way of approaching this, which works for some people, and that's when you go to sleep, you put two little earphones into the ear, get a radio, and turn the radio onto the static, so it's going, and you turn that static up above the noise of the tinnitus, so you can't hear the tinnitus, and you sleep with that for a few nights, and after that, that can block out the effects of the tinnitus. Works for some people, doesn't work for everyone. One thing is, never do that when you listen to my radio show. You've got to listen to the content, which might put many people to sleep. But that aside, there are a couple of new exciting things happening in the tinnitus world. There's a substance that's being trialled in France that actually can restore the sound for people. So we'll take the tinnitus away, maybe improve their hearing if they've got hearing problems as well. So they're trialling that at the moment, not clinically available yet. But what is available is a thing called the Lenaire system, Lenaire, I think it is, out of Ireland. And this is an intricate thing. It's a sort of weird thing. You wear headphones, you sit at a computer for a half an hour every day for about 12 weeks, and you put this thing on your tongue. So it's not painful. It just stimulates the tongue and basically has a huge benefit for the treatment of tinnitus. So Lenaire, Lenaire.
Okay. So we're winding up now. That's all we have on this week's Seriously Funny podcast. If you'd like more information on the podcast, as well as explore the amazing, newly released Ultimate Seriously Funny keynote speaking package that Ross and I are now offering, go to seriouslyfunnywellbeing.com. All you corporate heavyweights out there that are having a conference, don't bore your delegates to tears. Try and get two of the best speakers in the country to speak in a very funny way.
The two best.
Two best.
Two of
Okay,
the
sorry.
best.
I was going to make it a bit modest there. No,
well.
Okay. So it's bye from me, and Ross, it's bye from you.
Bye.
Thank you.
Hello, listeners in Australia. I've got a big secret to let out about my good friend Homer Papantonio, the corporate imposter. He's the best speaker I've ever heard. I only deal with the best. He's a great athlete, great cyclist too. And the real reason he's the best is that he uses the best omega-3 supplements on the planet, produced by Zinzino. Homer needs to perform at his absolute best on and off the stage. That's why he takes the best omega-3 supplement on the planet.
Well, yeah, I know about Homer taking Zinzino Omega-3. I've been using it too. It's derived from highest quality ingredients from all natural sources. These Omega-3 balanced oils are molecularly tested for toxins to ensure only the purest and freshest ingredients are used. You can even have a blood test to see what your Omega-3 status is.
Oh yeah, this Omega-3 from Zinzino is the single most scientifically supported supplement on the planet. And the health outcomes are big, really, really big. It's an absolute no-brainer for every man, woman, and child. It's the best, the biggest and the best. And you can buy it at zzomega.com. zzomega.com.
Like Homer, I've been sucking on Zinzino Omega-3 capsules and solutions for the past year. It helps reduce Alzheimer's and dementia risk, inflammation, mood, improve sleep and immunity, and the list goes on and on and on and on, like you do.
Don't worry about it. Well, Zinzino Omega-3 is the best. I only deal with the best. Go to zzomega.com. That's zzomega.com. Simply the best.